to our Chief Operating Officer, Antonio Lamont, who will introduce Senator Kamlager and moderate a conversation with her. And before I do that, I'd like to thank the Senator very much for making time to be here with us today and for her partnership and her leadership in authoring SB 679, which you'll be hearing more about shortly. Thank you. Antonio, I'll give it to you.
Thank you, Jen. Before we get into the questions, I want to tell you a little bit about the senator. Senator Sydney Kamlager is the senator for California's 30th Senate District. Sydney has nurtured deep ties within the district and has a long history of serving its communities. Early in her career, Sydney worked at the Social and Public Arts Resource Center in Venice, and then as an advocate for quality childcare and early education at the nonprofit Crystal Stairs in Los Angeles. She worked as district director for Holly Mitchell when Mitchell was first Assemblywoman and later senator. In 2013, Supervisor Mark Whitley Thomas appointed Sydney to the Los Angeles County Commission on Children and Families. Sydney was elected in 2015 to the Los Angeles Community College Board, where she fought to make higher education and career training affordable and accessible to everyone, with special focus on underserved communities and students who were previously in the foster care system or incarcerated. Sydney successfully ran for the Assembly in 2018. Please join me in welcoming Senator Kamlager. Good morning, or good afternoon, actually, Senator. First, I want to congratulate you on your election to the California Senate in March, and thank you for joining us today. Thank you also for supporting our virtual openings at both Floor 401 Lofts and the 649 Lofts in Joshua House. Before becoming state senator, you held positions ranging from Assemblywoman to district director of the 30th Senate District under Holly J. Mitchell. Can you talk a bit about your background and what inspired you to get into elected leadership?
Sure, and I just want to thank you for inviting me to this lunchtime conversation. It is always great to be able to talk about the issues that are important to me and to really elevate the issues of concern across the district. You know, I got my taste of politics at a very young age. I am born to a biracial couple who suffered actually housing discrimination because of it in the segregated city of Chicago. My mother has ties with the Black Panther Party. My dad was a social worker from the very beginning, and so I was sort of raised with a very activist mentality. I worked to help my grandmother get Harold Washington elected as the first Black mayor of Chicago long ago in the 70s. And that has never left me. My folks are also in the artistic, or they are a part of the artistic community. And what I find relevant about that is, you know, artists share stories and they move into uncomfortable spaces using the arts to help people really understand or see difference and provoke folks to get out of their comfort zones and figure out how their constitution needs to be fortified to deal with really important, controversial, difficult, provocative issues like housing, unaffordability, and like homelessness.
Awesome. In Los Angeles County, speaking of homelessness, there are over 60,000 unhoused individuals. And unfortunately, 73% of these people never go see a healthcare provider. You introduced the street medicine bill when you were still in the Assembly. Firstly, can you talk about what street medicine is and why it's important in this current crisis?
Well, healthcare is important. We know that healthcare is important for everybody. And the pandemic exposed the chasms, yes, in our healthcare access and in healthcare affordability. So that's A. Homeless folks are folks. They're just homeless. That doesn't mean that they don't need or require or deserve health care. What we do know from our system, however, so we know that about 85% of folks who are unhoused are eligible for Medi-Cal and have insurance eligibility under it. We also know that 75% of those folks don't use it. We have a system that's really sort of predicated on very traditional models around healthcare delivery. You pick up a phone and you call your clinic or your doctor, you make an appointment. You show up at the clinic and you have your ID card and you have your insurance card. You fill out the paperwork. They ask you, your history, and they ask you for updated address and phone number and email, don't they? They ask you for your updated ID card. You have to fill out your form with all the checklists about parental health history or your own health history. When you fill out a prescription, they want to know specific information when you're trying to get that prescription filled, yeah? They tell you, hey, we only have appointments at this time of the day, this time of the day, this time of the day in 2 weeks. And then the expectation is you're going to put all of that information in your iPhone or in your calendar. All of those things I mentioned are examples of barriers to healthcare access that are faced by homeless individuals. So AB 369 is about reconciling all of those barriers, because what we also know is that if you are not going to see a doctor, if you are not involved in preventative health care, then when you do get sick, it costs more money, it's worse, you're probably spending more time in urgent care in a hospital, and costs are skyrocketing for everyone. Compounding the reason why you're there with probably all of the other issues that you're having that you haven't been able to seek care for, you end up with these explosive visits as it relates to folks' health who are homeless. And so AB 369 is designed to fix that by having medicine come to the streets.
So in lay terms, what does it mean to have medicine come to the streets?
So in lay terms, it means I'm homeless. I'm at 6th and Town. Dr. Antonio is there, maybe Monday, Wednesday, Friday, or once a month on Tuesdays, and I go see Dr. Antonio. Dr. Antonio has my information, probably on an iPad or whatever, and I'm going for my checkups. I'm talking to him about my, if I have lumps in my breast, when I've had my period, if I have headaches. I remember once upon a time I had, high sugar. I'm not taking any medication for that. I got into a fight on Tuesday, but I'm seeing Dr. Antonio on a regular basis. It means Dr. Antonio is going to meet me at 6th and Town. It means that Dr. Antonio will be able to make sure that I have prescriptions that I can fill for any medication that Dr. Antonio was going to give me. It means Dr. Antonio is not telling me I have to call this number from 9 to 11 and go on the bus to go someplace else to visit him. That's what it means.
Thank you for that. I think that helps really bring it to life for people.
It also means that Dr. Antonio can bill for those hours. And now what we have a lot of street teams that are doing this, but they're raising money from philanthropic sources to allow them to do it. They're not, those doctors cannot bill. And so that's a big reason why we don't see more of this happening across the healthcare spectrum.
So you talked a little bit about the bill, and when you talk about the Street Medicine Act, what are some of the key things that you think are really important for this bill to accomplish?
Well, this bill will do a number of things. It will continue to destigmatize homelessness populations. Because it's not about charity. Me raising money to pay someone to provide health care to someone who's homeless, that's an act of charity. I think we have to dissolve ourselves from the notion that, especially in LA County, we're providing charity to a majority of Black and brown folks, since we know that over 50% of the folks who are unhoused in LA County are Black. So I am not invested in saviors and in charity. I'm invested in partners that are working to eliminate these systemic injustices. That's one thing. The other thing that it will accomplish is it will begin to reaffirm the importance of preventative health care for everyone, not just for those who have an address. The other thing I think it will do is force systems to begin to think flexibly. If you can only go to a brick and mortar facility, if you always have to have this kind of identification, if you having a lost card or not having your insurance card on you at all means that you will not be able to seek care. You know, we have a responsibility to fix that, to not make that a barrier to entry, because, you know, we know that even for folks who are housed, you have those kinds of challenges. And it will say that, you know, these are services that are billable, you know, so get into the business of taking care of folks who are unhoused. This will also help with coordinating services, because in my example, Dr. Antonio is not only giving me preventative health care checkups, you know, treating any kind of trauma or wounds that I have, but Dr. Antonio also has information about housing placements and other kinds of services that I may need. So we have to continue to be more coordinated in the kinds of services that we're providing to everyone, including folks who are unhoused.
Thank you for that. Housing is one of your top priorities as senator. You bravely championed SB 679, moving from the Assembly to the Senate in the middle of the legislative season. This bill, the Los Angeles County Regional Housing Finance Act, would establish the Los Angeles County Affordable Housing Solutions Agency, and would state that the agency's purpose is to increase affordable housing in Los Angeles County by providing for significantly enhanced funding and technical assistance at a regional level for renters protection, affordable housing preservation, and new affordable housing production. As you know, the Trust is a proud supporter of this legislation. Could you share with our community how it will address the crisis of homelessness in Los Angeles?
Yeah, and I first have to thank you all for being a partner in this. If you can imagine, we have actually had some folks who are trying to kill it. So we need as much of your muscle as possible to help us get this across the finish line. Housing costs too damn much in LA. That's just the truth of the matter. And we have a ton of little cities. Some are trying their darndest. Some are trying to escape what is in front of them. And some just don't have the capacity or the resources to make a true dent in approving the construction of affordable housing. And then you have that crazy word affordable, which means different things to different people, when you still know that folks are spending 60 to 70% of their income on housing. So this is a bold, ambitious bill. It really is, that really unifies the region of Los Angeles to get into finding a unified, cohesive, not the, but a solution to our housing and affordability issue and our homelessness crisis. The bill will do three things. It will provide renter protection, it will support housing preservation, and it will encourage and help finance housing production. Now, what that looks like in each of the different cities and in the county may be different for each of those cities. You know, Southgate is different from Santa Monica, is different from Culver City, is different from Pasadena, absolutely. It doesn't give anyone a pass, but we know that those cities often have challenges, right? Raising the kind of financing that they need to build. And we also know that those cities oftentimes get overshadowed by the big beast, which is LA City. So this bill is also about securing financing for the region and then helping to allocate it in ways that are equitable for both little cities and for the larger city. There will be creative financing involved. It will allow for land trusts to get involved, and we know that land trusts also have a really hard time going against some of the big guys. It will be the housing for it's the housing entity for renter protection, so that we have a central source of renter protection in the region, and that's really important. I'm excited about what this bill can accomplish. Cities like New York that have a housing authority have actually been able to attract over $15 billion in housing financing to really go towards moderate and affordable and below market housing. We have not had that kind of success, probably because of the infighting between cities, but also probably because of the confusion. And so this will sort of, I hope, ameliorate some of that. The good thing is it has a governance structure somewhat similar to Metro, where folks will have a seat at the table. And it's so important for us to have a seat at the table, because if you're at the table, then you can help channel the discussions around funding allocation, about resource acquisition, and it will allow everyone to be able to keep their fingers on the pulse of what's happening across the region and where folks should be working or working harder.
Well, thank you. And there are many in the region who really appreciate your leadership in this area. Some of the other top priorities as a senator for you include criminal justice reform, equity, education, and jobs, to name a few. Can you talk about your stance on some of these issues and the importance as we pursue an equitable recovery?
Yes, and I want to talk about it using a story, because I think housing and healthcare and economic justice and criminal justice, educational justice, environmental justice are intertwined. On Mother's Day, I was at Jim Gilliam Park with my family, and we ran into another family, a family of 5, that was living in an SUV. It was a man and a wife and their 3 kids, and they were not in a good space. The man was very upset with her, and we actually stopped to talk to them because we wanted to make sure that everyone was okay. We were talking to them, and as we were talking to Star and Deshawn, Star had this baby on her lap, and the baby's mouth was totally white, and I thought, well, what is this? Is the baby sick? Is the baby foaming? And it was yogurt. The baby was putting yogurt all on her face and all in her hair. And so I immediately was starting to ask myself, well, I wonder where they're going to be able to go to get cleaned up. And Star talked about how they didn't have housing. She'd been living with her mom. The mom couldn't deal, kicked them out. They couldn't find any place to live in their neighborhood. They didn't want to go outside of their neighborhood because they just didn't feel safe or comfortable. But they didn't have $4,500 for the down and the first, and they didn't have $1,900 a month for rent. They were living in their car. They would go to community-based organizations to fill out all of these applications, and they would fill out applications and give their information to these organizations, and the organizations would get funding because they had new applicants, but they were always denied. They were trying to stay in the free parking lot spaces, but they were either full or they didn't accept folks who were on probation, or they couldn't afford the $15. They didn't want to drive to the far away to some of the places that had available spots because they had expired tags, because they didn't have a license. They didn't have the money to get those things taken care of. And they were afraid to drive very far because they didn't want to get pulled over by the police because they were on probation. You know, it's a perfect storm. And at the end of that, Deshawn said, but I'm going to take care of my family. So I'm going to get my hustle on because I got to take care of my family. And we all know what that means. You do what you have to do to make sure that your baby has food, enough food to go to sleep. That whole story encompasses criminal justice, housing justice, economic justice, environmental justice. Deshaun should not be afraid to drive to find a place for his kids to sleep because he's on probation. That's why we did our probation reform bill. We have to be having different conversations with law enforcement so that they're not on the lookout for cars like Deshaun's with expired tags to give him a ticket, to then ask him if he's on probation, to find out that he is and then realize that he has no free liberties because he's on probation, to allow them to dig into the car and find all of the things that are wrong with that car, and then maybe lock him up again. That's criminal justice reform. Why we have 679 is so that they're not running from South LA to the Valley looking for a parking spot to sleep in where they're safe. And that's why we're working on 369, so that even until they find housing, that they have a place to go where they can see someone to make sure that they're all okay. Star said, I'm not asking for anything. I am living my life. I have dignity. She has dignity, but she needs more help from all of us.
Thank you for that story. I think it really brings home these issues that seem just like issues when they're on paper. But to hear it told through the story of real people really helps people understand why these issues are so important. And with that, I want to ask my final question of you, and that is, what do you hope your legacy will be?
I hope my legacy will be one around a re-engineered narrative on economic justice. We've spent a lot of time, especially during the course of last year, talking about social issues, which are incredibly important. They're also infused with economic inequities that people of color, Black folks, brown folks, immigrant folks have had to suffer through quietly. And it seems like we're always begging folks to understand our economics and how that has played such a huge role in either the dismantling or the devastation of communities of color, which doesn't mean we live in complete trauma and pain, but it means that we are always fighting for folks to understand that we have a right to self-determination and to economic independence. And so I'm hoping, I believe in the legacy of Marcus Garvey and fighting for, Black and brown, economic emancipation. And I hope my legacy will be one where folks understand those should not be scary words. And if you're fighting for, economic liberation, you can include us too, and it's okay.
Well, thank you for that, Senator. It's been a pleasure spending this short time with you this afternoon. We all appreciate you taking time out of your schedule to be here. I want to turn it back over to the moderator who will field any questions if you have time for a few questions.
I have time for some questions.
Okay. I want to turn it to the moderator.
Hi, everyone. My name is Lisa, and I am the Communications Project Manager here at the Trust. And I'm so pleased to host this Q&A segment with the Senator. Before we jump into the Q&A, I would like to go over our monthly call to action for supporters. So as Jet mentioned at the beginning, we are in the middle of our spring campaign. And if you click the donate button on the screen with a gift of any size, you can help us reach our goal of $125,000. Next, you can add your name to our list of advocates by clicking on the Add Your Voice button. And finally, you can sign up to receive updates by email by clicking on the Sign Up button. So next slide. All right, so let's see if we have any questions for the senator. If you wouldn't mind just entering your question in the chat box on Teams, or you can send an email to info@skidrow.org. Okay, great. So it looks like we have a question from Monica. Monica asks, having grown up in Chicago and experiencing the social injustices there at an early age, what drew you to the landscape of California politics and justice reform?
Great question, Monica. Well, the short answer is my dad. My folks got divorced when I was relatively young, and my dad moved out here. And I spent so much time with my mom, I thought I would come out to sunny Los Angeles to spend time with my dad while going to college. So I'd been admitted to USC. But I was also there during the Rodney King riots and actually the earthquake in '93, the Northridge earthquake. And those were really transformative moments for me. Watching a city burn, standing on the rooftop of my dorm, and seeing, Black communities up in smoke, and struggling to voice the pain that we all witnessed with the beating of Rodney King and then subsequently that trial of the officers, showed me what happens when you marginalize and devalue communities. And so that was really personal to me. And it also showed me how we have to work really hard to not cement those disparities or those chasms that happen between cultures. I remember being afraid to connect with my dad, who's not Black, because I didn't want to get hurt. I didn't want him to get hurt in the midst of trying to connect, during the riots, so that we would both be safe. As a result, I worked with Rebuild LA, and I worked with the LA Arts Festival, the LA Festival, that really talked about, building bridges and connecting communities and listening. And it used the arts to connect cultures and ethnicities, to help, inform about history and pain and frustrations and hopes. And so that was a really important time for me while living in Los Angeles. And it showed me all of the possibilities that can happen when you're merging activism, passion, policy, and community, and you're doing all of that in a way that's really authentic and shares power.
Thank you so much for that answer, Senator. Let's see if we have anybody else who would like to ask a question. You just type your question in the chat box, and we'll give a second.
Now, I'll also say, because the justice reform is not new, but it's something that as you live your life, you begin to see more and more these very stark disparities about the inconsistent application of policy and the inconsistent application of practice. And in the criminal legal system, when those inconsistencies happen, you see gross negligence with regards to due process and with regards to people's freedoms and their rights. And when all of those things sort of trickle into other spaces, like your ability to get a driver's license or get a job or find a house or stay out of prison, wow, you have real issues. and you wake up and you say, why does my community look so different? Where have all the people gone? Oh, I see. They've gone to Twin Towers. They've gone to Folsom. And it just seems to be my community. That's why the issue of criminal legal reform is so important to me.
Thank you so much. And we're so lucky to have you working on our behalf, and deeply grateful to you for your time with us this afternoon. We really are so thankful, and thank you to everyone who joined us. We hope that you will be back, our supporters, next month for our next virtual community meeting. Thank you guys so much. Thank you. Bye.
Thank you.
Thank you. What a great